Should healthcare providers get EHR software in 2011? Electronic health record/EHR software is mandated by the HITECH Act. The HITECH Act includes an EHR incentive program as well. To avoid forfeiting part of the HITECH Act incentive money, healthcare providers need to get started with electronic health record adoption and demonstrate the Centers for Medicare and Medicaid Services/CMS meaningful use criteria by 2012. Should healthcare providers wait until 2012? No. Although the initial costs and implementation challenges are considerable, the investment in EHR software will result in financial rewards and savings now. Why EHR software this year? Attracting new doctors. The 2009 Future Physicians of America survey found that 90% of medical students consider it important or very important to have an EHR where they choose to practice. Quote, the 5th Annual Future Physicians of America survey, conducted by Epicrates, Incorporated, revealed that medical students not only believe in the value of electronic health records, but expect availability when they practice medicine. Having an electronic health record is a very important factor for 70% of medical students in deciding where they will practice medicine. Taken from today's medical students are the most technology-savvy yet http www.epicrates.com/company/news/092910.html. Successful participation. EHR software is critical to your successful participation in initiatives such as patient-centered medical home. Medicare penalties. Starting in 2015, physicians and other eligible professionals who have failed to meet the Centers for Medicare and Medicaid Services/CMS meaningful use criteria face escalating penalties in the form of reduced Medicare reimbursements. Pay for performance. Use of certified electronic health record systems are needed to qualify for performance compensation programs. Payer requirements. Medicare and Medicaid are now requiring EHR software. Private payers will increasingly require electronic health records and meaningful use activities as well. Quote, the availability of an EHR may soon be a minimum standard for new physicians, public and private payers and patients. Patient engagement. Surveys have shown that 42% of consumers are interested in personal health record that is integrated with their physician and physician's records. Consumer demand. 55% of consumers want the ability to communicate online with physicians. Evolving standards. With HIT AA 5010 and ICD-10 on the horizon, physicians with EHR software can rely on their electronic health record system/EHR vendors to lead these transitions and guarantee compliance. Practice valuation. Physicians planning to sell their practices want to get the most money for their practice. Physicians can maintain their practice value by implementing electronic health record technology. If you sell in 2015 or beyond, the buyer would be hit with immediate penalties if EHR software is not in place, with the ability to demonstrate meaningful use. EHR software can, number 1, enhance your ability to attract a buyer, and number 2, increase your profits from the sale of your medical practice. Cash flow. Medicaid-eligible professionals only need to attest to A/I/U in order to receive incentive payments the first year. LI means Medicaid health care providers must adopt, implement or upgrade an electronic health record system. Medicare healthcare providers must demonstrate EHR meaningful use criteria for 90 days to qualify for incentive payments. Getting your EHR software now means you'd be ready to begin a Medicare qualifying period at the beginning of 2012. Then after 90 days, you can apply for your money. Incentive programs. Apart from the electronic health record adoption that is mandated by the HITECH Act, there are other physician incentive programs. The e-prescribing incentive program and PQRS requirements can be met with electronic health record software as well. In fact, it behooves you to use the certified EHR software e-prescribing capability by the end of 2011 in order to avoid penalties. Use your EHR software to get Medicare e-prescribing incentive payments in 2011. Then begin qualifying for CMS meaningful use incentive payments in 2012. E-prescribing and Medicare explain in article How can Medicare physicians get Medicare e-prescribing incentive payments? http electronichealthrescue.com/healthcare/news/how can Medicare physicians get Medicare e-prescribing incentive payments/for more details. Tax savings. Section 179 of the tax code allows up to a $500,000 deduction in 2011 for expenses related to electronic health record adoption. Consult your tax professional for the details. Access to data. The issue of lost patient records can be eliminated. And with it, the task of chart pulling will be eliminated as well. This means labor and cost savings for your medical practice. Better decisions. Electronic health records include rule-based clinical decision support, templates and protocols to help healthcare providers make better decisions. Patient safety. Immediate access to pertinent data and system alerts enhances care coordination, better outcomes and patient safety. Did these 14 reasons convince you that you need electronic health record software in 2011? The time is now. Get started with EHR software today. Got questions? About the HITECH Act, electronic health records, meaningful use, or the Centers for Medicare and Medicaid Services /CMS EHR Incentive Program? I invite you to claim free access to an informative interview audio titled How to Convert to Electronic Health Records When I'm Completely Technology Adverse and Don't Know Where to Start. Enter your name, your email address and your phone number below. And click I want the audio. Is electronic health record adoption a mystery to you? Don't have the time or expertise? Want to take advantage of EHR incentive money? Call Sandra Noble at 404-374-3384 today to schedule a free consultation. To find out about our music or meaningful use system implementation consulting program, providing EHR software, HITECH Act, and meaningful use assistance. Sandra Noble, 404-374-3384. Noble Finances. Noble & Associates Consulting, Incorporated. Electronic Health Record Rescue.com.